Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Michael Marchbank, the former President and CEO of the Fraser Health Authority, under whose direction we developed the commitment to surgical renewal in BC. We're honored to be here on the territories of the Lekwungen-speaking people, the Songhees, and the Esquimalt First Nations. As all of you know, on March 16, 2020, to ensure capacity in our hospitals to address COVID-19 patient needs, we made the difficult decision, the very difficult decision, to postpone non-urgent scheduled surgeries. Our commitment to those whose surgery was postponed was that they would not be forgotten, and they have not been. I've asked Michael Marchbank to provide his guidance on surgical renewal, and on May 7th, Premier Horgan announced our commitment to surgical renewal in BC. On the same day, we began calling patients to see if they were ready to reschedule their surgery. We resumed non-urgent scheduled surgeries on May 18th and have been providing weekly updates on our progress at our Thursday COVID-19 briefings. Last week, we provided our 11th weekly update. In an undertaking of this size, and with the resurgence in COVID-19 or a potential second wave being legitimate concerns, setting target timelines and achieving them is essential. We said that we would provide written monthly reports on progress starting this month, and today is our first monthly report. The progress report covers the period from May 18th to June 25th and examines our progress in completing postponed surgeries and in meeting ongoing demand for the surgeries patient needs. We have key targets in our surgical renewal commitment. We said that we'd start calling patients May 7th to reschedule their surgeries. 62,744 patients have now been contacted about their surgery. We said we would start surgical services on May 18th and would increase over 4 weeks to near normal pre-COVID levels. On June 25th, we achieved 97% of operating hours for the same period in 2019. Given where we were starting from, an extraordinary achievement. We said that by May 31st, all private contracted facilities would be working at maximum available capacity, and we achieved this target in early June. We said that in June we would begin recruitment and training of new staff. Recruitment efforts have resulted in the hiring of 111 perioperative registered nurses, 6 perioperative licensed practical nurses, 60 post-anesthetic recovery registered nurses, and 35 medical device reprocessing technicians. Since April 1st, with 29 anesthesiologists have been recruited to positions across the province. And between April 1st and June 27th, 28 registered nurses completed their perioperative training and 23 more started their training. We said that on June 15th, all existing operating rooms would be running at full capacity, and they were. We said that from June 15th to October 15th, we would substantially add additional capacity through extending daily hours of operation, adding Saturdays and Sundays to the schedule, and opening new operating rooms where available. That work has started. We said in July and August we would optimize full capacity over the summer period, and today we will be reporting, and you'll hear from Mr. Marchbank shortly, surgical activities this summer. The surgical slowdown in activity this summer will be reduced by 52% against what happened in 2019 through vacation management. We said that in July we would present our first monthly progress report on surgical renewal, and today we are doing just that. And with that, it's my pleasure to introduce Michael Marchbank to deliver our first monthly progress report on the surgical renewal commitment. Michael.
Thank you very much, Minister. It's my pleasure to present the first, as the Minister said, the first report. I will be taking us through a PowerPoint presentation, and hopefully everybody will find it helpful and informative. So an outline of the presentation, we are going to do a COVID-19 update. We are going to take a look again at our surgical renewal commitment updates and then the progress to date. When we developed the initial plan for the surgical renewal strategy, we based it on certain assumptions. As time has gone on, those assumptions have actually turned into facts, if you like, and what this chart shows is that about 32,400 scheduled surgeries were cancelled due to COVID-19. You can see on this chart that the durations for surgery have gone up by 26%. That was what we had found in the period, and you can see that done by health authority. So that reduced our throughput in the same amount of time. So less patients were getting their surgeries. You can see the wait lists. During the period from mid-March to mid-May, our wait list did actually increase by 7,900 cases, and you can see that on the blue on this chart. However, we believe there are 24,400 patients who normally would have come on the wait list who have not yet come on the wait list, but we believe that we will see those. Just for general information, prior to COVID, the wait list was 93,164. Today, at the end of this reporting period in June, it's 95,216. So in summary, we performed 32,400 fewer surgeries than expected. The surgical time, the length of the surgery increased by 26%. And although we added 7,900 patients, a further 24,400 patients that you would normally see still have to be, we'll still have to see those people. Now moving on to the second part of our presentation, it's the surgical renewal commitment update. And just a reminder of the components of our surgical renewal plan. The first was, of course, focusing on our patients. The second was increasing surgeries. The third, increasing essential personnel. The fourth, increasing resources. And then the fifth and last is the reporting of progress, or the timeline, which we are doing today. So as the minister said in his introductory comments, we're calling each patient on the wait list prior to May 7th, 2020, to see if they're ready and willing to have their surgery booked during the period of COVID-19. We also reset the priorities for surgical patients, focusing on urgent cases, patients who had their surgery postponed, and people who have been waiting more than twice their recommended clinical benchmarks. We had done previous work as we were preparing to increase surgery in BC already. And what we had done during that work is we had identified the availability of the physical capacity to provide these surgeries. And so we had the equivalent of 34,500 OR days a year. You can see the breakdown of those by private centers, after hours, weekends, eliminating or reducing summer slowdowns, and opening new ORs. Again, our assumptions for increasing surgeries. If you see the schedule that's outlined in the plan, and the assumption that we made and how long we estimated it would take to regain those surgeries were based on the 26% reduction in OR efficiency and bringing on the new capacity as quickly as possible. So you can see on this chart that it crosses over, if you like. So we catch up at about 15 months. So in our initial plan, it was 17 to 24 months. This chart shows 15 months, and the reason for that is that we made the assumption on a 30% reduction in or an increase in surgical time versus the 26%. So that accounts for the difference. On the next slide, sorry. You can see the amount of time we said that we would take, the 17 to 24 months. The model also suggests that we would increase the capacity by 17,700 OR days in 2021, which is about a 24% increase, and increasing that to next year to 33,400, which is a 45% increase. As I said earlier, this was in the early planning stages already as part of the government's commitment to increasing surgical services. So what we also looked at is assumptions about efficiency. If there is a second wave of COVID, which reduces non-urgent scheduled surgeries for 6 months by 10%, the timeline to recapture those patients would extend by 3 months. And if we were to eliminate Sundays and see no efficiency gains, we would never catch up. So you can see there are a lot of variables that actually affect how long it takes for us to recapture those patients that have been canceled and postponed. In terms of the efficiencies, improving the efficiencies, and you'll see later on in the presentations that we have made significant improvements on that. It has gone down from 26% down to 6%, really is giving us an insurance policy. It actually allows us to prepare for the impacts of a potential second wave and enabling us to address those 24,400 surgeries that weren't in the original model because we were unsure when they were actually going to come onto the wait list. So this increase in efficiency, if you like, and it's a tribute to all the employees and the rules that have been put in place around the safety of staff and patients, has allowed us to gain this insurance policy, which will be, I think, invaluable going forward. So in summary, recovering the lost cases is heavily dependent on our efficiency, using our new capacity, and having sufficient resources, physicians, nurses, beds to accommodate the additional case volumes and other challenges that may arise. Because the one thing with COVID is we can't predict the future, so we have to retain that flexibility. Now, I'm pleased to be able to report today on the progress to date. Again, I'll follow the same model. Our surgical renewal commitment is focusing on patients, increasing surgeries, and increasing essential personnel. So this covers the period from when we restarted elective surgeries on May 18th to June 25th. It does include a ramp-up period because we did not get to 100% of OR capacity until mid-June. So that is a caveat to remember as we compare numbers between this year and last year. In terms of focusing on patients, we again are we are focusing on urgent patients. So those are patients who need to have their surgery done within 4 weeks. Most of those cases are cancer and cardiac and neurosurgery. Patients who have had their surgery postponed, and patients waiting more than twice their clinical benchmarks. So with regards to calls, we have called, as the minister said, 62,700 patients. Our wait lists are becoming more accurate. 4,400 people have been removed from the wait list, and I'm pleased to say that the majority of patients are ready, willing, and able to come in for their surgery. You can see on this slide a report on how we've done in responding to our postponed patients. You can see as of June 25th by health authority, but also as a provincial total, that 52% of those patients who had their surgeries postponed have subsequently had their surgery in the May to the June period, which I think is a real tribute to both the providers and the patients themselves, and significant progress in what is essentially 6 weeks. In a couple of other areas, the first one I want to touch on is urgent surgeries. You can see from this chart that we are doing more urgent surgeries, and we are also doing urgent surgeries of patients who have been waiting longer than 56 days due to the backlog created by COVID. So we said we were going to shift towards doing urgent surgeries, and this chart clearly shows that. it has increased by 3%. And in fact, there is more urgent cases done this year than last year, even though there were 4,000 less surgeries performed. The other area is non-urgent surgeries or elective surgeries. So between the period of May 18th and June 25th, 19.4% of non-urgent surgeries of patients waiting 2 times their target benchmark have been done, versus 10.5% last year. So again, this is focusing on the patients who have been waiting the longest to have surgery. So in terms of increasing the number of surgeries, we are, as the minister touched on, looking at extending operating room hours, extending our summer capacity, increasing our OR efficiency, and performing more surgeries. So you can see that during the period from May 18th until June 25th, we were very close to the same amount of OR hours. And given that we had our ramp-up phase, as I touched on earlier, if that phase had not been there, we would have exceeded the number of OR hours. So we are making significant progress there. You can see on this chart the percentage of hours versus last year's OR hours. The one number that I would point out is the Northern Health Authority, or NHA, at 85%. The reason that is not in the same neighborhood as the other ones is that they've had a mechanical issue with one of their air exchange units at UNBC, which is being fixed. So that accounts for that. One of the areas that we focused on in the report was reducing the summer slowdowns. The minister touched on that earlier. You can see that we have reduced that by 52%. I can tell you from my experience as a CEO that that's one of the things we tried many times to do, and we were unsuccessful. And to see this response, I think, is terrific, and it speaks to the hard work of all the surgical team in making this happen, and I think reflects that the members of the surgical team actually are quite concerned that there was the pause in elective surgeries, and I'm very pleased to see that they've stepped up. As you can see on the next slide, the efficiencies, as I said earlier, our inefficiency factor was 26%, if you like. It's now come down to 6%. So in essence, surgeries are lasting 6% longer than normal when compared to last year. Obviously, that means less cases get done. So I think that's, and it varies from health authority to health authority. And so that, as I spoke about earlier, gives us that insurance policy that I think is so important for us. So the volumes of cases completed, again in the time frame, is 91% of last year's volumes. The one thing that I will point out, and it again reflects back to the ramp-up phase, is that since we reached full operations on the June 15th, the volumes have been 100% or more than 2019. So I think that that augurs well for increasing the volumes of surgeries going forward. And you can see by health authority how that is going. In terms of essential personnel, we have provided extra funding to Health Match to assist them in recruiting healthcare professionals, and in particular, they have focused on anesthesiologists. So that's a positive. Since April the 1st, we have, as the minister said, recruited 29 new anesthetists for the province. That I think is quite an accomplishment and speaks to that BC is an attractive place for an anesthetist to come to. I thought I would just draw one example of that, and that's in Surrey, where the anesthesia group have recruited new anesthetists, 4 new anesthetists, and they are, and you can see it reflected in improved patient volumes. So more patients are having the surgeries they need. It's increased the volumes compared to last year, so from 2020 to 2019 at Surrey Hospital by 5%, and at the Jimmy Pattison Pavilion by 12%. And so I think That speaks to us being an attractive place for anesthetists, and Health Match is continuing to work diligently and have about 64 total anesthetists in the pipeline, if you, so to speak. So I think that's a positive sign for anesthesia. In the other members of the surgical team, the minister touched on that earlier. You can see that the 28 RNs have completed their training, 23 more have begun, and you can see the recruitment numbers there. The last point I would add is since April 1st, 760 new graduate RNs from nursing schools have been hired by the health authorities across BC. So that's just about half of the graduating class, and recruitment is still continuing. So in summary, 62,000 patients have been called. Urgent surgery volumes have exceeded last year's volumes despite the ramp-up period. There's been a significant shift in focus to the patients who have been waiting the longest, 2 times their suggested clinical benchmarks. Our volumes compare favorably to last year, and the summer slowdowns have been reduced by 52%. And the recruitment and training has begun. So I think it's fair to say that our initial progress is encouraging, and I think has been quite significant. However, I don't want to say that everything is going to be perfect, because I don't think it is. There's a lot of hard work ahead of us. There's going to be setbacks and challenges that are going to test us. We have to address these issues to fulfill the surgical renewal commitment. We have to make sure there are sufficient staff. We have to make sure there are efficiencies in the system and how we manage patients on the wait list. We have to implement new schedules and support extended days and weekends, which is new for the system and will require a lot of effort. But I sincerely hope that we're able to meet this commitment, and I know everybody in the system wants to do what is right for our patients, and that's to significantly increase the number of surgeries that we are able to perform, get back the wait list, and begin the process of bringing our wait lists down to where they should be. So with that, I will conclude and say thank you very much.
Thank you very much, Michael, and I just want to say, just in conclusion, how appreciative I am of the work that Michael is leading. He's been an exceptional leader in public health care many years, but his work on this project indicates our determination to follow the evidence, to have outstanding leaders, and to give them the opportunity to lead. And I'm so appreciative of Michael's role, just as Dr. Henry and Steve Brown have been extraordinary leaders of our emergency response to COVID-19. Michael is doing an exceptional job, and his work is reflected in the work of health authority chairs and health authority staff, in Ministry of Health staff, and of course, all the people working in healthcare. I think what is most encouraging about what Michael Marchbank just reported on is that it's the efforts of all of us in flattening the curve in the early days of the pandemic to bend, to flatten this curve, stopping the spread of COVID-19, that allowed us to relaunch surgeries on May 18th. And for all of those people who have benefited from that to benefit from it, it is efforts of people in every part of this country, and all the people that would listen to this now, and all of the other people, that we've been able to have visits in long-term care, that we've been able to open up parts of society, that we were able to resume public education, in-person public education in June. It's our collective efforts that allows these things to happen. I'd like to thank the healthcare workers, health authorities, and everyone else for the role they play, and I want to thank all of our patients, especially those whose surgeries were postponed, for the sacrifice they made that continues to drive us all to fulfill our surgical renewal commitment. And I just want to say finally, and it's a reminder to all of us, it's a reminder to all of us when we report every day on COVID-19, that nurses, doctors, all healthcare workers involved in surgical renewal, everyone working to fulfill the commitment, is counting on every one of us to stop the spread. If we do our job, they can do theirs. And right now, they need us to do our job, especially right now. And with that, I'm happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press star 1 to enter the queue. Please take your phones off mute. You will not be audible until I call your name. You are limited to 1 question and 1 follow-up today. First question is from Vaughn Palmer, Vancouver Sun.
Good day, Minister. Good day, Mr. Marchbank. Got a note this morning from somebody saying that we should beware of these numbers because not all surgeries are equal. Some take a lot more resources and time, and the suspicion is that the numbers are being boosted by smaller, shorter, faster, less time-consuming surgeries to make the numbers look higher. Is there any way, looking at the numbers, to tell whether or not that's a fair criticism of what's going on here, please?
I'll ask Michael to answer that first, and then I'm happy to follow up.
I think, to be fair, as we started surgeries with the focus on urgent surgeries tend to be those such as cardiac and cancer and neurosurgeries. They tend to be longer surgeries, and so they would be they would be complex cases, and they would actually not. It would not. Your comments wouldn't be appropriate in that case. We have looked at the data, and there does not seem to be a significant shift other than in urgent that would indicate that we are pushing through shorter, easier cases.
And just to follow up on that, Vaughn, and say that, when we're looking at these numbers, and as we have week into week, that's been a consistent discussion that we've had, like what are the surgeries we're doing and what aren't. I just want to make the one point finally to that these are all medically necessary surgeries in the public system, which means they're all needed by people. And whether those surgeries are hip replacements, cardiac surgery, as Michael's referred to, cataract surgeries, whatever the makeup of those surgeries, they're all medically necessary, and they're all effectively urgently needed. And that's the approach we're taking. But I think the specific answer to your question, Vaughn, because we've consistently looked at this, is the makeup of this the number of surgeries that's been done in this period is not really very much different than any other equivalent period in the past, except for the addition of more urgent surgeries.
Do you have a follow-up, Vaughn?
Yes, please. I was quite struck by what you'd said about the holiday period in the summertime and the 52% saving or rollback, whatever you want to call it there, that as an administrator of a health region, you tried to tackle that in the past and hadn't gotten anywhere, and it's quite an achievement, and I would agree. The question I would have for both of you is this a one-time thing, or is this sustainable going forward? Can the healthcare system in British Columbia be changed to deliver these kind of results on an ongoing basis?
I agree with you. It is an accomplishment, as I said, and it is something that we are going to have to look to continue moving forward if we're going to meet the surgical needs of the patients in BC, because we are going to have to consistently increase the capacity so more patients can get done. So that will include how we schedule in the summer. But in order to do that, we are going to have to add those personnel that we talked about. The physical resources, i.e. the ORs, are there. The beds are there. We just need to increase the staff so that there is not felt to be a need for that summer slowdown, as well as extending on weekends. So we are going to have to do that not only to catch up with the patients that have been canceled or postponed due to COVID, but also to meet the future demands that we know are coming and that we know are out there.
And I think, Vaughn, it really reflects the approach we've taken in a number of areas. I mean, with respect, for example, to diagnostic testing and MRIs, we knew we needed to expand the numbers, but we also had to use those resources that we had, those MRIs we had, 24 hours a day. And what's happened in the years leading up to COVID was people have now got used to coming in and getting an MRI at 3 in the morning. And I can't tell you how enthusiastic, regardless of how the temporary inconvenience people are, to take advantage of that. So we've increased the numbers, but we've dramatically increased how we've used the service. And of course, that does require more staff to do, but we're talking about using existing resources to their full. And that means the summer, and that means weekends, and that means you have to, of course, work with your team. You have to have more resources in place. But I think in a public healthcare system in 2020, we have to use the resources that we have to the fullest possible extent. And I think that's why it was so important to have someone with Michael's experience in charge of this, because I think he's helped us get there, as he did as the president of Fraser Health in our diagnostic, our ambitions for diagnostic services. And I think we can make the system more productive, and we need to work with our whole team, including surgeons, including nurses, including healthcare workers, to make that happen, including health sciences professionals to make that happen.
Next question is from Richard Zussman, Global News.
This is for Minister Dix, and it's a bit off topic here. Based on the information we saw yesterday, Minister, should British Columbians be worried that we could have to go back to phase 2 because of this potential of explosive growth of COVID-19?
I think you heard from Dr. Henry and myself yesterday that, I'm concerned when there are 10 cases. I'm concerned when there are 15 cases. So when there's an average of 34 over 3 days, it absolutely has my attention, Dr. Henry's attention, all of our attention. And what it tells us is, because we know what we can do, because we showed what we can do in March and in April and in May and in June, that we have to use the tools at our disposal, and they can be used. Physical distancing is critical to that. And it's more important, I'd argue, when, say, in your case, Richard, or anyone's case, when you're working at the legislature, than when you're working out of your home. And that's true of everybody, and it's true when we travel, and it's true at every other time. So we just have to, I think, recommit ourselves fundamentally to what we've learned, which has worked. And we've seen it work. We produced a serology report that the BC CDC, this exceptional serology report, first of its kind in Canada, it showed how we flattened the curve. And people could see in that data their efforts. And so we have to continue to do that. There may be changes we need to make and adjustments we need to make, and you're going to see some of these in some of, I believe, in some of the orders this week as we work to improve and to cut off potential transmission. And you see it in the work we're doing right now, for example, in Kelowna in interior health, working with the business community, working with the municipality in Kelowna, Mayor Bazran, working with the opposition MLA, Norm Letnick. We're all working together to communicate better. So we have there, for example, in delivering our message, a lot of social influencers who have been involved in putting out messages in the last few days, a renewed commitment to address areas where we have seen transmission, for example, resorts and houseboats and others. And so I think we are going to have to adjust and adjust and adjust again and again and again throughout this pandemic, which I remind everybody is not going away. There is no cure and there is no vaccine. So we have to continue to make these efforts. We continue to have to make adjustments, and we will under the direction of the medical experts. And we all have to continue to be committed, and that's worked for us so far. We know it will work, and we have to continue to double down on what's made British Columbia a leader in this area. We can't rest on our laurels, though. We see it in Washington State. There was a day when there was more than 1,000 cases. We saw it in Alberta yesterday, which had 3.5 times the cases we had, and we were struck by the number of cases we had. So imagine. I think we have to learn from this, and we have to know that if we continue to do the things that we're supposed to do. We can have surgery, we can have visits, we can get out in the community, and we can enjoy our summer.
Do you have a follow-up, Richard?
I do, and you mentioned these new regulations that will come in this week. And you keep mentioning houseboats. Like, are there cases linked to houseboats? We heard this mentioned yesterday by Dr. Henry, but no specifics. And who are these regulations going to target? Is this going to be restaurants, bars, resort operators? Like how broad or how specific will these new regulations be?
No, I think we have to make some adjustments working with these sectors to make improvements. But we also have to acknowledge that there are unorganized circumstances that were involved in this outbreak in Kelowna, and that we have to take responsibility for those. We have to work with the owners of certain businesses to improve the circumstance in those businesses, and that's the purpose of it. So a lot of it won't be new regulation, although I expect some adjustments in those things, and you'll see that in public health advice and potentially in public health orders. But it's also the work we have to do together, the commitment we have to make to one another. And the final thing I'd say is we have to operate with our eyes open, with the understanding that the people we're most likely to affect negatively by not following the guidance of Dr. Henry are the ones that we love the most. I tell people, Richard, I live, my wife Renee and I live in an apartment from about 800 to 850 square feet, and well, under the order, we could have quite a few people there. As a practical matter, our maximum would be 4. It just would be 4, and we all have to look at this practically. And finally, when people are having parties within the guidance of Dr. Henry, we have to keep track of who's there, and somebody's got to be responsible for that, because if something happens, that allows us to do what we absolutely have to do, which is trace the contacts and break the chains of transmission. If we can do that, we'll have a lot of success.
Next question is from Camille Baines, Canadian Press.
Hi there. I'd like to know if there's been any consideration of modeling being done to take into account the number of COVID cases the system could handle to keep this surgical renewal plan on track.
Well, that's some of that preparation, of course, has gone on, has been going on from the time really of the changes we made in acute care in March and April. If we have a second surge, whatever you would describe it, whether now or in the future, we are modeling based on our own experience in BC now. So as you know, in March and April, we had about 20 COVID-19 centers, which were essentially our major acute care hospitals in BC. As we plan for the fall, we're going to adjust that. One of the reasons you adjust that is to maintain in a number of those hospitals surgical capacity. So we may have fewer COVID-dedicated hospitals for that reason. So we're learning all the time. And I think it's one of the strengths of Dr. Henry and Steve Brown and Mr. Michael Marchbank and others, is that we haven't got it right every time, and they haven't got it right every time. But we have been prepared to make adjustments where required. That's what we're doing this week, and that's what we're doing as we prepare for the fall and for a period where, regardless of what happens with COVID-19, we're expecting, of course, in flu season to see an increase in respiratory conditions.
Do you have a follow-up, Camille?
Yes. If there is a surge in cases, and even if there isn't, has there been any looking at how technology could be used to see, for patients to see specialists, because first they're waiting to see the specialist, then they're waiting to have the surgery. How could those two wait times be compacted?
Well, I think you've seen in this period of COVID-19 a transformation of virtual care, and and certainly and I think we'll be presenting on this soon, Camille, on the sheer the enormous increase in the amount of care, from primary care to other kinds of care, that has been done virtually in the last few months, which is, I hesitate to call it exponential, but it's a large amount. And I think what we've seen, because that has worked for a lot of people, both practitioners but also for patients, we're going to see some of the reticence people have had to pursue virtual care options go away. So I think there is very significant opportunity in pursuing virtual care. It's already happened, and I think what's happened under the unfortunate circumstance of COVID-19 is really a shift in thinking both amongst patients and in the healthcare system about that.
Next question is from Binder Sajjan, CTV.
Hi there. I'm just wondering, out of the 62,700 people who were called for surgeries, how many people decided that they just weren't ready at that time? And I'm wondering, like in tandem with this slide number 13, where you're saying if a second wave of COVID resulted in 10% of non-urgent surgery scheduled for 6 months, that would extend this timeline for another 3 months. That seems to be far fewer than what we saw in the first wave. So wondering if you think maybe that's a little optimistic.
Oh, I think it's our general tendency to be to make assumptions that are pessimistic, because we have to prepare. We have to prepare for all scenarios. So we're certainly doing that. It's a relatively small number, I think, and Michael may have the exact number. But we've been delivering. I think we've been giving you that number every Thursday. It's a small percentage of patients who, for COVID-19 related reasons, have not wanted to pursue their surgeries at this time, and I think that shows a renewed confidence, just as we've seen a renewal in emergency room visits, or return to pre-COVID levels of emergency room visits. In fact, in Island Health, a return to over pre-COVID levels of emergency room visits. We're seeing a relative confidence in people pursuing surgeries, but I'll hand it over to Michael. But we'll get you the number within the hour.
Do you have a follow-up, Binder?
Bit off topic. Yeah, sorry. Just a bit off topic. Lynn Valley Care Center put out a release talking about a mysterious phone call that they got early on in the pandemic that they say sort of kicked them while they were down. Just wondering if you have a bit more information you can share with the public with regards to the nature of that and the impact on that facility.
Well, I can confirm there was a hoax. I can confirm that Vancouver Coastal Health appropriately informed the RCMP, and really there's not much more to say than that. One of the things that I believe powerfully is that in a time of pandemic that's affected so many people around the world, we need to be generous. We need to be generous sometimes with people when they don't follow all the rules to our satisfaction, both personally and other ways. As long as people's intent is there, as long as they're trying to be good people, as long as they're doing their best, I think we've got to be generous, and we've got to be especially generous to the people who've tested positive for COVID-19 and all of the physical damage that can cause, but also obviously the anxiety that can cause to them and their whole communities. So on all of those circumstances, I think generosity and kindness is absolutely appropriate. When people don't behave, when people do things to intentionally disrupt people in a very difficult time, I think that kind of behavior is obviously totally unacceptable, and that's why it's been referred to the RCMP, and I'll leave it to them to make any further comment.
Next question is from Lisa Houston, News 1130.
Taking it off speakerphone here. At what point would beds have to start being cleared again? You know, we saw 51 cases on Friday. So at what point would you have to start clearing out hospitals again to allow for space for the potential of increased COVID cases?
Well, I think you saw the data, and you're tracking the data probably, I think, more closely than anyone. At least I see that, Lisa, so you know this, that we went from 18 acute care patients to 16 in that same period. Now, hospitalizations sometimes lag cases, so we have to be careful about these things. Overall, we've gone from 149 people in acute care hospitals on around April the 6th to those 16 today, and it's been bouncing between 10 and 18 for the last couple of weeks. So I think that right now we're obviously in very good shape to manage the situation. If hospitalizations start to increase, we'll have to adjust for that. But we've got a significant number of acute care hospitals around the province, and we're in good position now. But we are preparing, and you saw what those preparations were in March. We prepared in those circumstances for an Italian-style outbreak, for a Hubei China-style outbreak, and considered other possible scenarios. Now we can judge based on what happened here in British Columbia and its impact here. But you saw the extent of the preparation. We have still have the convention center in downtown Vancouver available. We still have other temporary places available to us should we need to expand capacity. So we are obviously prepared for that. But at this stage, in terms of hospitalization, we're still seeing a relatively low level of hospitalization. I think yesterday as well, there were 4 patients in all of BC in critical care.
Do you have a follow-up, Lisa?
I do. Looking at what we're seeing recently, and a lot of people sent me tweets yesterday when I was writing about the numbers saying, it feels like there's 30% of the province who's doing the hard work of limiting our connections so that 70% of the people can live as if nothing has changed. I'm wondering what your take on that is, because I'm hearing this more and more, that people are feeling like, I guess essentially it's unfair that the brunt of the work is being pushed onto a minimum of people to keep the connections low.
Well, first of all, the sacrifices people have made are real, and they continue to be real. And you saw a little bit of that yesterday in our report, our survey of 390,000 British Columbians. Almost 10% of the adult population took part in that survey, which shows the profound interest out there and the willingness of people to engage. You saw their experience, what they've lost in terms of mental health, and what we're seeing every day, and the consequences for people's jobs, for their businesses, for their livelihood. So I think I just don't accept, and I know you're using the numbers as an example, but I don't accept that 30% figure. Overwhelmingly, people have been part of this in BC, and overwhelmingly, they're still part of it. One of the challenges we see, and we've seen this from time to time, you'll remember there was a weekend in March, and there was a little discussion in the Easter weekend and even the Victoria Day weekend about people who weren't following the rules. And sometimes that happens in public and causes distress. And all of us, as we go around in our daily lives, sometimes see that. But what I can tell you is, and you see this in the numbers, is that we had overwhelming compliance, an overwhelming willingness to support and to follow the advice by Dr. Henry and Dr. Daly and Dr. Pollock and all of our public health leaders, Dr. Stanwick, all our public health leaders from around BC. And that's still the case. But we've got to continue to do this for month after month to come. And I know how tiring that is. I mean, I know how tiring it is. We've, Dr. Henry and I have been doing briefings for 6 months, and you know, all of the people, and many people have been following that for 6 months, and it feels like a long time. And when I say, look, it might be another year of this, or longer, or significant periods of time, I think that causes people anxiety. But what we have to realize is that this is the new normal, and that we've got to continue to dig in here. Because what we do by following the advice of Dr. Henry is to allow people who are suffering to get surgery, allow seniors in long-term care to get visits, allow people to get back to work, allow children to get back to school, allow the people that we love and care for to be able to live normal lives within the constraints of a pandemic. And so I'm asking people to keep going and to be with us. It's not too late to join the fight, and we have to continue to do that.
We have time for a couple more questions. Next is Nick Johansson, Castanet.
Hi, Minister Dix. It seems clear to anyone here in Kelowna walking downtown on a Friday or Saturday night that a lot of the tourist population, maybe not a lot, but a certain segment don't appear to care about a lot of the best practices when it comes to safe going out on the town. You talked about doubling down on getting the messaging out to people who are coming here about best practices. Is simply putting out that message enough?
No, but it's one thing, and it's one thing we have to do, and we have to be determined to do that, to reach populations that maybe don't watch Dr. Henry and me at 3 o'clock, that maybe don't read Castanet or go on CHBC or listen to Phil Johnson or to Chris Walker in Kelowna, right? We need to reach people. And so part of the communication of that message is finding new ways to do that. And I'm so proud, and you'll see it on Instagram, the work of different people in different walks of life, from people involved in fitness, to food, to tourism, to community activities, who are posting on Instagram right now to get that message out. It's not the sole response, but it's a response. Secondly, obviously, we're engaged in very significant contact tracing. And what we're saying to people is, help us. If you're in a group, note, as we ask restaurants to do, who's in the group. So should something happen, we're able to respond. Because if you respond quickly, and you've seen this in previous presentations by Dr. Henry, our ability to control transmission is greater after 1 day than it is after 2 days, than it is after 3 days. So we need to do those things. We need to continue to take action and to refine and to improve our strategy with respect to health orders, and that will continue to happen, and it will continue to be led by medical health officers. And we've got to work with all the partners. This is a community effort. And I just ask people not to be deterred if they see someone they don't think is acting the way they should. That doesn't mean they should be disappointed in that. That we need to work together to do better. And the final thing I want to say is this, that a lot of the people we're counting on to help us in this, people who work in liquor stores, serving staff in restaurants, when they ask people to do something, I know that's not what one goes. Sometimes one goes to a restaurant to relax and to be outside of the constraints of normal of our normal lives. But we need to be especially respectful to those people who are trying to ensure that our safety is maintained. People who work in restaurants, people who work in tourism, people who work in liquor stores, people who work in grocery stores. To be respectful of them, because their role is as important as Dr. Henry's and is as important as mine.
Do you have a follow-up, Nick?
Yeah, we've heard here at Kelowna General Hospital, where we've had 6 confirmed cases of COVID. We've heard that staff members who've been exposed to their coworkers who tested positive but aren't exhibiting symptoms themselves, they've been encouraged to continue to come to work until they receive any positive test results. Is this a wise policy? And what would you say to the staff and potential patients who might have concerns about coming to the hospital?
Well, I can say that our efforts to control transmission are being led by outstanding public health leaders, and they're giving the advice that they see as appropriate in the circumstances based on the evidence. And, you know, I know that there's lots of desire to talk about individual cases, which we don't do unless it's needed, unless we need to do it. We declare outbreaks where it's appropriate to declare outbreaks, and we have not been shy in doing that. But we have some of the most outstanding public health leaders in the country, led by Dr. Henry, and they make those decisions based on need, and they are living COVID-19. And I can assure you they wouldn't take any steps to put people in harm's way.
Last question is from Keith Baldry, Global News.
Minister Dix, yesterday Alberta reported 368 cases over 3 days, one of their biggest increases for quite some time. A surge in hospitalizations to more than 80 now, including another increase in ICU cases. Given the extensive travel between both provinces that will occur this summer, how heightened are your concerns about what's happening in that province in terms of people bringing the virus into BC or British Columbians going to Alberta and bringing it back here?
Well, I think if you look at what's happened around Kelowna and the cases that have come out of the last number of weeks there, those cases are now include the Vancouver Island Health Authority, the Vancouver Coastal Health Authority, the Fraser Health Authority, the Interior Health Authority, and of course other provinces. And what it tells us is that we are not isolated in British Columbia, that we have to take the steps necessary, that we are living in a sea of COVID-19, whether it's Washington State, whether it's Oregon, whether it's California, whether it's Alaska, or whether it's Alberta. And so what that tells us is that in order to continue to flatten the curve, we have to follow the advice of Dr. Henry. It should be a call to us about what can happen when that doesn't happen. And, you know, we shouldn't make any mistake about this. They have outstanding public health leaders in Washington State, and they've had days of more than 1,000 cases. They have outstanding public health leaders in California. They have outstanding public health leaders in Alberta. And so we should not be naive about this. What happens in British Columbia is very much in the control of British Columbians, as Dr. Henry said yesterday, and we have to continue to act in that way, in this new normal, to enjoy our summer, but to stop the spread of COVID-19.
Do you have a follow-up, Keith?
Yes, the survey yesterday suggested that 4 out of 5 British Columbians back the public health measures. Again, to our neighbor to the east in Alberta, do you think that same level of support exists amongst Albertans towards those public health measures?
Well, I think that people in Alberta have done extraordinary things as well. Healthcare workers in Alberta, doctors, nurses. I'm in touch regularly with the government of Alberta. So, you know, I think what's really important is for us to, of course, recognize the sacrifices and the achievements that have made up to now here. Understand that the pandemic is still on. Be humble, because I'm telling you, and this is true whether you're in BC or Alberta or Italy or Japan or South Africa, wherever you are, COVID-19 doesn't care. It doesn't care about our speeches. It doesn't care how nice we are. It is relentless. And so our job, and this is the strength of having public health care in BC and a community that supports public health care and is working together, our strength is us. And as long as we remember that and continue to act as if there's a pandemic on, we're going to get through this, and we're going to get through it together.
That's all the time we have today.
Thank you. Merci beaucoup.